NDIS currently is being assessed on the basis of the amount of money being spent. That shouldn't be the assessment. The assessment should be, what are we getting out of it? And the other reality is that when these packages go out to people with disability, they're going to end up in the community, in the economy anyway.
Yeah.
So what's the problem? Yeah, sure, it's going to cost you 4 billion, but that 4 billion is going out to small businesses out there who are providing services like lawn mowing at your house or cleaning or gardening, whatever. So, but yet our focus is still very much on, we've got to cut the cost of NDIS. So we need a cultural shift there to start thinking about people with disability as contributing members of our economy, and therefore looking at what value we get out of NDIS rather than the cost of the NDIS.
Suresh, you talked in greater depth on disability. We got the understanding of how they have shifted away from the or the design flaws. You mentioned the words, and in your experience while you're working with the community services or community organization, how are the crossroads of the purpose and sustainability comes about to play? Because funding is always scarce in these organizations, and where they are working for a larger purpose beyond the funding, the social capital, social value they bring in to the community is way large than the dollars they expend or they ask for. So how does that purpose play in those scenarios?
Look, it's a very, very difficult one, because it really is just trying to shift the organizations and governments to start thinking in terms of the outcomes again. We keep coming back to saying, look, let's not look at the cost here. We really need to look at what are the outcomes that are resulting from that injection of X number of dollars into an economy, into a person's system, so that they can then spread it out to the economy. We all know that there's a huge multiplier effect of any monies that go out into the economy. The reality is that people with disability, for example, they have a very, very low marginal propensity to save. So in other words, they save almost none of their money. Whatever money they get is going back into the economy, because they're spending every last cent of what they get. So they live from payment to payment. So we know that their multiplier is going to be quite significant. Whatever money we put into the disability system, whatever money we pay to people with disabilities, is not going anywhere except back into the economy, because it pays for services, it pays for goods, it pays for things for them to survive. So there's a significant part that needs to be done there. But look, that's very much all of the work that I've done in the disability space. I've also done a fair bit of work in the general racism and migrant community space, and I've also done a lot of work with the international students over the years. I've argued long and hard that the issues around mental health are a significant challenge for us in Australia. And the reason I say that is that most of us come from cultures and language systems that don't have the nuances that English has. So, for example, in the language that I speak with my mum and so on, it's a language called Malayalam from the south of India. There is only one word that describes depression, anxiety, and it's a word that says, I'm mad. So for me to go and seek advice for my depression or anxiety, I have to admit in my mind and my language that I'm mad. And likewise the same in languages like the Noongar language and so on. So there is a real difficulty. I've argued that, for example, the young lady that took her 2 children and committed suicide, torched the car recently. Her husband was on his way to America to see his brother. She was a nurse at Fiona Stanley, well documented in the press. I've argued in her case, for example, she came from a similar cultural background, linguistic background to mine. she would have to have gone through the process of admitting that she was mad to access any advice in regard to her mental health. That would have been a very difficult exercise. So rather than face that, and rather than face that whole, I guess, stigmatization of being mad in my community, she's actually chosen to go out and commit suicide.